From the Pep Radio newsroom, this is the news blast for this hour. We have a message from, let's see, Mary Bockovich, Chief Executive Officer of Allies for Health and Wellbeing, and she writes, Dear Ally, I write to you today with an urgent request for you to act. The White House has released details of their proposed 2025-2026 budget, and it is absolutely devastating. Deep cuts in funding, as well as program consolidation, are placing 55,000 individuals living with HIV/AIDS nationwide at risk of losing their housing. The president's budget calls for combining housing opportunities for people with AIDS with Continuum of Care programs such as Allies Permanent Supportive Housing Program into the Emergency Solutions Grant, which caps assistance at just 2 years. What does this mean for Allies clients? With a 2-year limit on assistance, it could mean homelessness. During the early days of the AIDS epidemic, before federal programs for people with AIDS existed, the Pittsburgh AIDS Task Force offered legal assistance for those facing eviction due to an HIV/AIDS diagnosis and supported fundraisers for people with AIDS who were struggling to pay rent. Today, Allies operates a permanent supportive housing program for 39 HIV-positive individuals, including some single parents with children. Many of our clients have been in our housing program for more than 8 years. While the average income for those who are working is about $19,000 a year, some have no income at all. The cost to provide housing and utilities for these households is approximately $35,000 per month. Allies simply cannot afford to absorb this expense long term. What are the consequences of housing cuts? Homelessness and housing instability can lead to serious health consequences. As you know, treatment adherence is paramount for people living with HIV/AIDS. Treatment adherence leads to viral suppression, better health, and the inability to transmit HIV through sex. Studies show that access to integrated care that includes social support such as housing increases viral suppression rates. Allies is committed to providing integrated care, including medical care, behavioral health, and support services. But we need your help. The housing cuts are just one piece of how the proposed budget will damage the health of our clients. That is why I'm asking for your help today. We must ask our senators to consider the impact on the most vulnerable Pennsylvanians in this and all future budget proposals. Please reach out to our senators and express your concerns. If you are not sure what to say, there will be messages made available on the Pennsylvania Equality Project website at paequality.com. We'll also be posting a pictograph and infographic on our Facebook, Blue Sky, and Instagram accounts. To reach Senator Dave McCormick's office in Pittsburgh, call 412-803-7370. Again, 412-803-7370. To reach Senator John Fetterman's office in Pittsburgh, call 412-803-3501. Again, that's 412-803-3501. Folks, this is an urgent crisis, and we would like to get as much support through phone calls, through emails, through letters written to Senators McCormick and Fetterman as much as possible. Again, the information will be available on our social media platforms and our website. That's the news blast for this hour. Download the Live 365 app to take Pep Radio with you wherever you go. Up next, we have the local area weather forecast for Meadville here on Pep Radio.